Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good afternoon, Mrs. Peterson.
Hello, Dr. Reynolds. Thank you for seeing us.
Of course. Now, I understand your son, Jake, has been having some difficulties with swallowing. Can you tell me more about what you've observed?
Yes, Jake seems to struggle, especially when eating solid foods. He often coughs or chokes, and it takes him much longer to finish meals compared to other kids his age.
I see. And for how long have you been noticing these symptoms?
It's been going on for about 6 months, but it seems to be getting worse.
And has Jake mentioned any pain or discomfort while swallowing?
He says it feels like the food gets stuck sometimes, especially around the middle of his chest.
Thank you for the details. Has there been any significant weight loss or changes in appetite?
Not really a weight loss, but he's definitely been eating less. I think he's scared of choking.
Understandably so. Dysphagia, which is the medical term for difficulties, can have various causes. We'll need to run some tests to get to the bottom of it. Has Jake had any history of throat infections or surgeries?
He had tonsillitis about a year ago, but no surgeries.
All right. It's also important for me to know if there's any family history of neurological or muscular disorders.
Not that I'm aware of, Doctor.
Thank you. I'll make a note of that. Now, based on what you've described, we may need to conduct a swallow study, which will give us a clearer picture of what's happening when Jake swallows.
What does that involve?
It's a non-invasive procedure where Jake will swallow a special liquid and will use X-ray imaging to watch how it moves through his esophagus. It can help identify any physical or functional issues.
Will it be painful for him?
No, not at all. He might find the taste of the liquid a bit unusual, but there's no pain involved, and the test is quite quick.
That's good to know. I just want to understand what's causing this and how we can help Jake.
Absolutely, and that's our goal as well. In addition to the swallow study, I'd also like to refer Jake to a speech therapist who specializes in pediatric swallowing disorders. They can offer valuable insights and techniques to help him swallow more safely and comfortably.
That sounds like a great idea. Anything that can help him.
We'll work closely together to ensure Jake gets the best care. After the tests, we'll discuss the results and any necessary treatments or interventions. Remember, early intervention often leads to the best outcomes.
Thank you, Dr. Reynolds. It's comforting to know that we're taking the right steps.
We're here to help. Let's get Jake scheduled for the swallow study and I'll also provide you with the contact details for the speech therapist. We'll get through this together.
Thank you so much. We really appreciate your support.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good afternoon. Mrs. Your optometrist has referred you to me due to some concerns regarding your eyes. Keratitis, I believe?
Yes, that's correct. I have been experiencing some discomfort and redness in my eyes. My optometrist said it might be keratitis.
All right. I do have the notes from your optometrist, but if you don't mind, could you describe the symptoms and when you first noticed them?
It started about 3 months ago. I initially thought it was just eye strain because I've been working longer hours on my computer. My eyes felt itchy and sensitive to light. Then, about a month ago, the redness started. My vision got a bit blurry, and there was this constant gritty feeling as if there's sand in my eyes. It's been quite distressing.
That sounds uncomfortable. Have you been using any over-the-counter remedies or eye drops?
I tried some lubricating eye drops at first, thinking it was just dry eyes, but it didn't really help. Then I got an antibiotic drop from the pharmacy, but it only gave temporary relief.
Do you wear contact lenses or have you had any recent eye injuries?
Yes, I wear contact lenses. I've been wearing them for about 10 years now. I haven't had any injuries, but I might have slept with my contacts in a few times accidentally.
That's an important detail. Improper contact lens care can certainly be a risk factor for keratitis. Now, how about any prior eye surgeries or infections?
No, nothing like that. This is the first time I've had such an issue.
I understand. And how about your general health? Any other health conditions or medications you're on?
I'm generally healthy. I do take antihypertensives for my blood pressure, but that's about it. I'm not diabetic or anything.
Good to know. And has anyone in your family had similar eye issues?
Not that I'm aware of. My family mainly has glasses, but no major eye diseases.
All right. Based on what you've told me, we will need to conduct a few tests to determine the cause and extent of the keratitis. We'll look at the type of inflammation and if any microorganisms are involved. Your contact lens use might be a contributing factor, so we might discuss proper lens care and potentially take a break from wearing them for a while.
I see. I'm really hoping for some relief and a solution. This has been affecting my daily life quite a bit.
I understand your concerns, and we'll do our best to get to the bottom of this. Depending on our findings, there are various treatments available, including specific eye drops or medications. We'll ensure you get the appropriate treatment.
Thank you, doctor. I just want to get back to normal, and I'll follow whatever recommendations you have.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Initially, when I started my role as the lead pharmacist in the hospital, it was challenging. With the ever-evolving drug protocols and frequent updates in drug interactions, I had to be on top of my game. Not to mention the responsibility of ensuring all our meds are properly stored and ensuring the right doses get to the right patient. I coordinate closely with the nursing and medical teams, ensuring they are updated on any changes or potential drug reactions. My main goal is to ensure patient safety. The head of the department has been supportive, always willing to listen and provide guidance. Together, we've been able to implement new strategies to streamline the drug delivery process, making it more efficient and safer for our patients.
Now look at question 26.
Good afternoon, everyone. I'm here to share the results of our study on intermittent fasting in the elderly population. Given the popularity of intermittent fasting in recent years, we wanted to see its impact on our older adults. Our cohort comprised 50 individuals aged 65 and above who participated in a 16-to-8 fasting routine over 3 months. Surprisingly, while many studies show significant benefits in younger adults, our findings suggest mixed results for the elderly. About 60% experienced stabilized blood sugar levels and reduced inflammation markers. However, 40% reported feelings of fatigue, dizziness, or had a notable decrease in muscle mass. This underlines the importance of individualized care and monitoring when recommending dietary interventions for our older patients. Further studies with larger sample sizes are needed to better understand these findings and to ensure the health and well-being of our elderly population.
Now look at question 27.
So, can you tell me what's been bothering you lately?
It's just, I've been feeling really anxious lately, especially in social situations. I keep thinking everyone's judging me.
It sounds tough, but remember, you're not alone in feeling this way. Social anxiety is something many people deal with. It can stem from various reasons, including past experiences or our own perceptions of ourselves.
That's comforting to hear, but I just can't help but overthink every social interaction I have.
I understand. But therapy can offer techniques and coping mechanisms to help you navigate these feelings. It's about understanding the root cause and finding ways to manage it.
Now look at question 28.
The pediatric department's concerns are next on our list. John, can you update us?
Absolutely. The main issue we're facing is the shortage of pediatric nurses. As a result, our current staff is stretched thin, and we're having difficulty meeting the specific needs of each child.
That's concerning, especially given the unique care requirements of children. Are we taking steps for recruitment or additional training?
We've opened up recruitment drives and are also considering collaborating with nearby nursing schools for internships. However, the process takes time, and we need to ensure quality care in the meantime.
Agreed. Let's also consider additional training sessions for our current staff and perhaps look into temporary nurse contracting until we're back to full capacity.
Now look at question 29.
Your performance in the OR was commendable today, especially given the complexity of the procedure. However, I noticed you were a bit hesitant when making that initial incision. Can you walk me through your thought process?
Thank you for the feedback. I think I was a bit anxious because it was my first time performing this particular procedure unsupervised. I wanted to be absolutely certain of my markings.
That's a good approach. Remember, it's always better to take a moment and double-check than to rush and make an error. Over time, with experience, you'll gain more confidence, but always keep that diligence.
Understood. I'll keep that in mind and appreciate your guidance.
Now look at question 30.
Dr. Smith, I've been monitoring Mr. Roberts, and his blood sugar levels seem to be fluctuating a lot. I've followed the prescribed protocol, but I'm unsure about the next steps. Should I adjust his insulin dosage?
It's a common issue with some diabetic patients, especially if they're not maintaining a consistent diet or exercise routine. Before adjusting the insulin dosage, it's crucial to first understand the root cause. Has he mentioned any recent changes in his lifestyle or diet?
Not that I'm aware of. I'll make sure to discuss it with him in detail.
Good. Always gather as much information as you can. The goal is to ensure a holistic approach to patient care, not just treat symptoms.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
As healthcare continues to evolve, so too does our understanding and management of various conditions. Today, I'm joined by Dr. Eleanor Thompson, an expert in nephrology and the co-author of a recent groundbreaking paper on nephritis. Dr. Thompson, can you explain to us the latest developments in nephritis management and treatment?
Certainly. Nephritis, which is essentially inflammation of the kidneys, has long been a complex condition to manage. With advances in medical technology and our understanding of the disease, we're making significant strides. To start with, diagnostics have improved greatly, enabling early and more precise detection.
That's fascinating. And how does early detection impact the patient's journey?
Early detection is crucial. It means we can initiate treatment before significant kidney damage occurs, which can improve long-term outcomes. Moreover, with personalized medicine on the rise, we're starting to tailor treatments based on genetic and biomarker profiling of each patient.
So personalized medicine is playing a role in nephritis management too?
Absolutely. By understanding the specific molecular pathways involved in a particular patient's disease, we can target therapies more effectively. This not only enhances the therapeutic effect, but also reduces potential side effects. It's a more efficient and patient-centered approach.
And in terms of non-visit care, how is technology playing a role in managing nephritis?
Technology has been a game changer. Patients with nephritis often require frequent monitoring. With wearable devices and telemedicine, we can monitor patients remotely, checking their vitals, and even certain kidney functions. This minimizes the need for frequent hospital visits and provides real-time data to healthcare providers.
What about the times when a patient does need to come in for specialized treatments or tests?
Those moments still exist. For example, certain imaging tests or biopsies might require an in-person visit. However, the goal is to make those visits as efficient and valuable as possible. Streamlining appointment schedules, utilizing point-of-care testing, and optimizing in-clinic processes can significantly reduce patient waiting times and improve their overall experience.
So moving forward, what's the future of nephritis care?
The future is promising. We're working towards more targeted therapies, better patient monitoring, and increasing patient empowerment in managing their condition. Technology will continue to play a pivotal role, and as we gather more data, AI and machine learning could potentially assist in predictive analysis, helping us foresee and manage flare-ups even before they occur.
It sounds like we're on the cusp of some groundbreaking changes in nephritis care. Dr. Thompson, thank you for enlightening us today.
It was my pleasure. The field is rapidly evolving, and it's an exciting time to be involved in nephrology.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
With us today is Dr. Emily Robinson, a renowned allergist and co-author of a recent publication on the rising prevalence of allergies. Dr. Robinson, can you enlighten us on the main objectives of your recent work?
Certainly. The primary focus of our recent research was to cater not just to medical professionals, but also to educators, parents, and guardians, so they can better understand allergies. Our publication includes insights from pediatricians, immunologists, and of course allergists like myself. We aim to demystify what allergies are, how they manifest, and the best practices to manage them. Anyone who has seen a child or anyone experience an allergic reaction knows it can be quite distressing. Our objective is to equip everyone with knowledge to help deal with such situations.
So, Dr. Robinson, how can one identify if someone is having an allergic reaction?
The signs can vary. Some may experience skin reactions like hives or eczema, while others might have respiratory symptoms, such as wheezing or shortness of breath. Gastrointestinal symptoms like vomiting or diarrhea can also occur. The severity can range from mild to life-threatening, like anaphylaxis. It's essential to be aware of these symptoms, especially in environments where allergens are present, so prompt action can be taken.
And once these symptoms are identified, how long should one wait before reintroducing the allergen?
Ideally, one should never reintroduce a known allergen without medical supervision. Even if initial reactions were mild, subsequent exposures can result in more severe reactions. Always consult with an allergist or healthcare professional before making any decisions.
So who's most susceptible to developing allergies?
Genetics play a role, so if there's a family history of allergies, asthma, or eczema, there's a higher risk. But environmental factors are significant contributors too. Urban living, dietary habits, and even our obsession with cleanliness might be influencing the rise in allergies.
With schools having so many children, do you think every educational institution should have specialized allergy management plans in place?
Absolutely. Given the increasing prevalence, schools should be prepared. Staff should be trained to recognize symptoms, administer first aid, and most importantly, know when to call for emergency assistance. While having an allergist on call might be impractical, having a comprehensive allergy management plan is essential.
In some countries, there's a push towards having allergy detection devices in public spaces, similar to AEDs. Your thoughts on this?
It's an intriguing idea. Devices that could quickly test for allergens in food or the environment could be a game changer. While it might not be feasible everywhere in high-risk areas or large gatherings, such devices could indeed be beneficial. But the primary focus should still be on education and awareness, as they are our first lines of defense.
Got it. Lastly, there's a buzz about allergy immunotherapy. Can you shed some light?
Yes, allergy immunotherapy, commonly known as allergy shots, involves gradually exposing the patient to increasing amounts of the allergen. The goal is to retrain the immune system to become less reactive. It's a promising approach, especially for those with severe allergies. However, it's not suitable for everyone and requires close medical supervision. Always consult with an allergist to explore the best treatment options.